Good afternoon. Welcome to the Voices for Prevention Legislative Panel today. My name is Carmen. I have the awesome privilege of just serving as moderator for today's panel for Voices for Prevention. We'll be talking about what's on the legislative docket. What do we need to be focused on for policy for the state of Georgia as it relates to substance use, prevention, treatment, recovery, as it relates to mental health issues that we're facing in the state of Georgia. And I'm excited because we have a power packed panel for you. Say that three times, power packed panel, waiting here for you to share. These are people whose heart and mission is all about prevention for the state of Georgia, recovery and treatment for the state of Georgia. They live and breathe this stuff. So we want to make sure we brought the experts to you. And if you have questions, we're going to ask that we'll have a time for question and answer at the end for you to ask your questions to get clarity. Each person will have an opportunity to share. And then we'll have a discussion and dialogue if there are some things that we need to discuss further on here. Some other things come up that may allow us as Voices for Prevention to say, hey, that's another topic we want to dig deeper in. If that's something you realize, then we'll go and make sure we get what we need to dig deeper for another call and to give the opportunity for us to do that. So I won't belabor our time. I'm going to quickly just share who we have on our panel, and then we will allow them to share. So he's not quite on yet, but Jeff Breedlove, he's the Chief of Communications and Policy at the Georgia Council on Substance Abuse. And then we have John Bringale, who is on. He's the Project Director for Georgia Prescription Drug Abuse Prevention Initiative. Take a breath, for the Council on Alcohol and Drugs. And then we have Michael Mumford. He's the Executive Director of Georgians for Responsible Marijuana Policy and the Board President for Georgia Alcohol Prevention Alliance. And joining him is Kelly Michael Moselle. And I hope I'm saying your name right, Kelly. All right, awesome. And he's with the Georgia Addiction Counselors Association. So didn't I tell you we had a jam-packed group, that we have a power-packed panel of great information? So I've already shared with our panel kind of the order we're going in. Jeff will come on. We'll add him in when he comes. So we're going to allow you, John, to kick us off, since I had you next on our agenda, just to share about the council, share about the work that you do as it relates to prescription drugs, and then anything we need to know around policy, initiatives, and advocacy for your topic. All right, John, it's on you. Do you need to share your screen? We can't hear you. And you're not muted and we can't hear you.
I know.
John, we
John,
can't
we
hear
can't hear
you.
you and you're not on mute.
And you're not on mute, so I don't know. Is your volume down
The
on your
volume on your
laptop?
computer maybe off.
Uh, One more, just I'll give you a minute. We might kick it off to Michael while you figure that out. 2 seconds.
Hey, John, can you hear me?
You can hear
Okay.
us. We can't hear you.
I'm going to
So the
suggest,
volume,
John, that you log off and then log back
Yep.
on.
And so, hey, listen, in the world of facilitation, what I tell everybody that shift happens. And so we're going to have Michael kick us off with his presentation and the information, again, this Power Pack panel. So Michael, Kelly, I know you all have coordinated, so please take it away. We look forward to what you have to share. And I know you have some slides to share with us.
Thank you, Carmen. And thank you, Esther and Voices for Prevention, for inviting me to this opportunity. I appreciate it. And so, as Carmen mentioned, I work with two policy organizations. One is Georgians for Responsible Marijuana Policy, and the other is Georgia Alcohol Prevention Alliance. So I've got two things to talk about under both: two marijuana and two alcohol. But then there's even a bigger one on the alcohol with Kelly Mazzell is really the driver for. So I was really happy that he could join us today. So I will start sharing now. I'm going to start on the marijuana side. You may have heard the biggest news about marijuana in the last 10 or more years, that last week President Trump signed a bill that became law banning intoxicating hemp products. It's the most significant federal action on THC in a decade and directly addresses GRMP. That's us, GRMP. It addresses our number one policy priority to close the Delta 8 loophole, which many of you have heard us talk about. The new law bans all high potency and chemically converted hemp derived products, including Delta 8, Delta 10, THCO, and all those other alphabet soup of intoxicating hemp products,
Wow.
and preserves only legality for agricultural hemp with very low THC levels. Total THC, not just Delta 9, but total THC under 0.3%, and significantly also limits servings to zero point 0.4 milligrams. And since it takes the new user probably 2.5 milligrams to get high, keeping it at zero point 0.4 is very significant. You can still eat a boatload of gummies and get high, but you'd have to eat a boatload of gummies. So at least we're making some progress there. Why was this important? These products were unregulated because of the Farm Bill loophole, and I won't do a deep dive on that, but they were unregulated. Youth had access to them through retail vendors, meaning gas stations and convenience stores. Lots of seniors in high school used these products. It was even higher in the Southeast. There were pediatric poisonings, meaning children thought they were eating gummy bears, and they were gummy bears, but they were loaded with THC, and there's hundreds. I think we're already at 600 this year, and we're not, the year's not even done, and 70% of those who call in for poison end up in the ER, in emergency room. So these products were hurting teens and kids. 0.3% can still impair. It's important to know. There's frequently chemical contaminants, and there weren't medical grade testing standards for these unregulated products. So it's a really big deal. Why does it matter for Georgia? I'm not going to read every line on this, but I'm going to skip down to here. This is going to increase youth protection and family safety. Consumer protection, so people know what they're buying, and public health. Law enforcement, it's going to end the confusion between hemp and marijuana that stopped so many from our sheriffs and police chiefs from even addressing marijuana. And it's going to still support Georgia's hemp industry. So we can still grow hemp for rope, for fiber, for those industrial purposes. So our recommendation is to support the new federal ban. We still have to bring that down to the state level. I'm hearing that even though this is an important little thing here, even though marijuana is illegal at the federal level, why do we have medical marijuana states, 24 of them, 24 recreational states and 40 medical? And there's complicated reasons about the tension between federal and state. So there's no guarantee that Georgia's going to make intoxicating hemp illegal, but it is explicitly illegal at the federal level. It's not a loophole. So it's going to be a lot harder for states to dance around that conversation. So, but it's not for sure. So we got to make sure Georgia follows suit. So we want Georgia to align state law with the federal law, to educate retailers and consumers about what's legal and what's not, strengthen enforcement, which should be hopefully a tad easier now, and support agricultural hemp producers. We're not trying to put farmers out of business. The federal government's taken decisive action. We should follow suit. So that's one. I don't know if I should stop there and ask for any questions or go on to the next one. Any immediate questions about hemp specifically?
I
All
don't
right,
have
I'm
any
going to go
about,
to.
I was gonna say I don't have any about hemp, but just, and maybe we can address this later, but just is there a then, now that that's in place, is there a are there efforts or a system or protocol for how that's going to be rolled out to states, to communities, in particular the law enforcement in that piece?
As I
Are they
understand, Carmen, technically it's illegal immediately, but enforcement won't happen for a year. So No, there's not a protocol for how that's going to be done. In fact, I think this goes to the USDA because now the USDA is in charge of hemp. And so they have to determine the rollout, enforcement, and education protocols for this over the next several months.
Gotcha. Thank you. I think Steve has a question.
Steve.
Yeah, is the hemp product, are there other uses for hemp besides what we're talking about, like smoking it, I guess?
Yeah, good question, Steve. There are industrial purposes. It is used for things like clothes and rope and other, I used to have a list of 6 things it's used for.
Okay.
There are valid industrial non-ingesting purposes for hemp. So it is a viable farming product.
Okay, good. Thank you.
Okay, I'll keep going. Now, when we talk about marijuana, we talk about really 3 things. Hemp, which we just addressed, medical marijuana, and recreational. Now, recreational is not an imminent threat this year. It'll pop up. I mean, someone in the legislature will propose a bill to legalize marijuana, but it'll probably be a Democrat. And because of that reason, the Republicans wouldn't. If the Republicans are going to legalize marijuana, it's going to come from them. That's just something they like to do. So we don't have any immediate threat for recreational. That leaves medical. Now, medical still has some very important threats going on. So I'm going to talk about SB 220. This is a bill that popped out last year, and it would broadly expand medical marijuana in the state of Georgia. Now, I don't have the numbers up here, but let me give you a quick overview. We have about 33,000 people in Georgia that have a medical marijuana card. 33,000. That's like 0.4% of our population. In Florida, they have over 1 million people with medical marijuana cards, which is like 4 or 5% of the population. So if we do anything like the Florida model, which is what this bill proposes to do, we could easily have 10 times the number of medical marijuana users that we have today. Does that math make sense? Okay. So that's why it's a threat. But not only the number of people, but also what they're using. So here are the 6 major changes with this bill. This bill proposes to increase potency from a 5% maximum to 50% maximum potency. That's like converting morphine to fentanyl. It's like magnitudes of potency. Secondly, it would authorize vaping of medical marijuana. And there is no vaping of medical anything that any medical association would support. So it's really pretty egregious in our humble public health perspective. Thirdly, it would eliminate severe or end stage requirements. Since medical marijuana is not FDA approved, the reason it was ultimately legalized is said, oh yeah, but let's be compassionate. Someone's got cancer or Alzheimer's or something, and they've ran out of things that are working. They might die soon. Let's let them at least be comfortable and use marijuana. So most of the conditions for which medical marijuana is eligible have severe or end stage requirements that they're now proposing they get rid of, which means as soon as you get something like cancer, even like a skin cancer, now you're eligible for medical marijuana. What's the big problem with that? It really it would normalize marijuana as a medicine when it's not FDA approved, it's not dispensed by a pharmacy. There's no dosage. Doctors don't get trained on this. It's really so getting rid of severe or end stage just makes it like a vitamin almost. Fourthly, it adds lupus as an eligible condition. Lupus, there's not valid scientific evidence that medical marijuana helps lupus. In fact, the Lupus Foundation itself does not support medical marijuana for lupus. Fifthly, it would allow advertising of THC products. And we know even if they don't advertise to kids, kids are going to see these ads. And it further normalizes marijuana as a medicine. And we know that when people have lower perceived harm, the risk that the usage goes up. So that's why normalization is such a key word for us. And lastly, it would allow up to 2 ounces of possession. 2 ounces of possession doesn't sound like a lot, but it would be over a year's supply of medical marijuana. And that just increases opportunities for overdosing, for diversion. So it's like there's no reason we need to have 2 full ounces of medical marijuana. Um, I'm not going to go over the risks of marijuana. I think you're all pretty clear how even medical marijuana can be abused. What we're doing is getting a lot more people using marijuana on a daily basis. And when you use marijuana on a daily basis, your risk of becoming dependent goes way up. So what we're doing is profit, addiction for profit. We're creating more profitability by getting more people addicted to this product. For this reason, Georgians for Responsible Marijuana recommends opposing SB 220. That's our number 2 priority in the legislature this year. Any questions on medical marijuana or SB 220? Okay, stop me anytime. I'm going to go to now alcohol. Now, alcohol, I'll be honest with y'all. GAPA, Georgia Alcohol Prevention Alliance, is completely not funded. There's no budget. It's 6 volunteers. It's really hard to pass laws when you have no staff. We've tried. In fact, I'm going to show you 2 quick bills. They're not bills. They're 2 legislative efforts that we've tried to get signed in, that we tried to get someone to champion it, a legislator. Hasn't worked yet. We don't have immediate hopes that these 2 next ones are going to get written into a bill. But I'm going to mention them because they're on our radar. And if you, the advocate, wants to get engaged with these, we need you at GAPA. So there's immediate opportunity for you to plug in. One is lowering blood alcohol content from 0.08 to 0.05. Now, why is that important? These bars over here on the right show you the number of alcohol-related fatalities that happen in Georgia. It's been going up every year from 2019 to 2022. It's over 500 a year. So it's a 43% increase in the last 3 years. That's one of the fastest increases in the nation. And when you look over here on the left, even drivers with 0.05 to 0.079, which is what this law would impact, this bill would impact, are 7 to 21 times more likely to die in a single car crash than someone who hasn't had any alcohol. So you still are impaired at 0.05, 0.06. And in Georgia, impaired driving represents 28% of traffic fatalities. So a quarter of the people who die in car crashes had alcohol. So that's how many are preventable, right? We could chop those numbers down pretty quick. That's all the time I'm going to spend. We've got a really great brief on this. Mothers Against Drunk Driving and the National Transportation Safety Board are big, huge national advocates. We're not alone when we join in this effort. The second one is alcohol and cancer. Who knew that alcohol is a big risk factor for alcohol? In fact, it's the third leading cause of cancer after smoking and excess body weight. Alcohol is down here, it's third at 12%. 12% of all cancer deaths have to do with alcohol. The policy recommendation, I'll skip right. So, no, let me say this. It increases the risk of cancers for even moderate drinkers. Even if you have 1 to 2 drinks a day, you are increasing your possibilities for cancer. 1 to 2 drinks a day increases possibilities for all these: breast cancer, liver, colorectal, esophageal, etc. So the science is really stacking up on this. What do we want to do about this? We want cancer labels. We want labels, which the U.S. Surgeon General recommends, that people know about this, that there's either signage in the stores or labels on the alcohol. There's going to be huge resistance. The alcohol industry is going to fight this tooth and nail, literally almost. So with that, I'm just going to turn it over. I'm going to stop right there and say, does anyone have any questions about these two alcohol efforts that have not yet resulted in legislation, cancer or BAC?
Michael, I was just wondering, and actually this could be a question for both of the topics that you just covered. Are you going to give us maybe some names of key people that we should contact or that we should share this information with?
Oh, thanks. With alcohol and cancer, I wouldn't have anyone to recommend other than your own legislator. So if you know your own state legislator or state senator, these are always worthwhile topics. Now, I will say with the two marijuana ones, these are active legislation, and you can always start with your legislator. That's never a bad place to start. It's always a good place to start. But there we could be taking more action on these two, the hemp ban and SB 220. As we get closer to the legislative session, I'll have like a specific call list of who's on these
Okay.
committees and things like that.
Yeah. Okay. Thank you, Michael.
And I'll be sending this package to Carmen and Esther, who will distribute this to anyone who wants these as talking points. Now, with that, but we're really happy that GAPA is collaborating with Kelly Michael Moselle and Amy Sorrells. And I'm going to turn it over to Kelly to talk about some of the legislation that he's been championing. Kelly.
Thank you. Thanks for having me. Um, some of the work that Michael has been doing, we have collaborated quite a bit around the marijuana work and more recently alcohol. At Georgia Addiction Counselors Association, we have been working to make a very simple change, and we'll share a little bit about this. So currently in the state of Georgia, alcohol is excluded from the drugs that we can treat at substance use disorder treatment centers. So let me repeat that. Currently, alcohol is not allowed to be treated at treatment centers as a standalone issue. And it's because of a definition in the law that's been around for quite a while. The law specifically excludes alcohol. It essentially says all mind-altering substances except alcohol and its derivatives. So our proposal is to a very simple one, to change except to include alcohol. So Georgia is unfortunately out of sync with the rest of the country when it comes to how we define drugs to include alcohol. We really, we've had the Department of Community Health threaten to shut down treatment programs that were treating alcohol use disorder as a standalone issue. And if you paid attention to Michael's numbers about alcohol in his last two issues he shared about, alcohol is a problem in Georgia. We have a problem just like anywhere else. So 178,000 deaths per year are attributed to alcohol use disorders. In Georgia, we saw more than 6,000 people die between 2015 and 2021. And we don't have the current numbers, but we know that alcohol consumption went up during COVID. I mean, in fact, the governor signed a law that allowed it to be home delivered to you during COVID. Um, Lots of other health risks, including cancer, which, um, you know, until about a year or so ago, I didn't realize, maybe 2 years ago, the significant link to cancer from alcohol, just um, moderate alcohol use. So despite it being a significant problem, people cannot go to treatment just for alcohol use disorder. So one of the things that people will say, which is fairly accurate, is most times that we see substance use disorders, there are other co-occurring disorders, mental health, trauma, whatever it may be. But during those initial screenings and assessments, you may not get to that co-occurring. So people are being turned away because the co-occurring issues are not being seen in those first 2 hours that you spend with someone. Um, it is a problem. So people are not getting the help they need. Some people are being forced to go out of state. So just from a financial revenue thought, it also keeps the stigma of alcohol use disorder rampant, but I don't want to talk about it. I can't even get into treatment. Or the opposite, well, those people are drug addicts. I only drink alcohol. So it is actually such an easy fix to remove this barrier just by changing the definition um, with a very simple wordsmithing fix. We did have this dropped last year. There is currently no active opposition to this change, but we need the excitement to get people to carry it across the finish line. So that's really what we need at this time. So it's not going to change the scope of practice for any practitioners. We are trained to treat alcohol use disorder if you're credentialed in the state of Georgia. So that's not going to be a change. It's not going to cost treatment programs any more money. So we're going to bring this again this year and try to drum up support from people to help us get this across the finish line this year. So
Uh,
I haven't met with you guys before, so I don't know exactly
so
all
if
the,
they're in,
but
I'm sorry, go ahead.
no, but what questions do you have that I can help?
Well, Kelly, you said that there's no active opposition, but it didn't pass. And so, what do you think are the unspoken barriers to something like this?
I think one is just getting the word out that so that people will be aware that this, I mean, I don't think legislators know that it was sitting in committee. We need to get the committee to pick it up because there are lots of other competing issues for folks to pick up on. But I do worry that, the alcohol industry could find out and become an active opponent. But so far that they are unaware of it. So I think it's just not sexy or shiny or, whatever so far. And I think that since GACA is new at trying to get legislation passed, I don't think we realized that, yeah, we got it to committee and everyone seemed okay with it, that you really need a lot of work to get the committee to act on it and move it forward. It would be my takeaway from it.
Did it have
Kelly,
a
were you in
champion?
touch
Go
with
ahead.
the author of the bill, Blake,
Yeah,
Senator Tillery?
Yeah, he was. I don't know if he will still be, but he was chair of the Appropriations Committee. Jeff Breedlove was our advocate working with the legislators. Um, I think there, to me, it just seemed like we're not gonna, we don't have time to deal with that. It's been this way for a long time. There's no urgency, I guess. Um,
So
so,
Kelly, I have a question. One of the things that we do is provide resources for all of our members, right? And any providers. I know that in the past, Michael has given us an issue brief that we have been able to email out. And again, it's all educational. Um, uh, but do you have a handout that we could send out as well? Because this could be included in the packet that we're putting together to send out to everyone. I wasn't aware of this, until now. So I think there are a lot of people in the prevention field that probably are not aware of this. And this is again something it's about educating. So it's not going to go against any type of funding or anything like that. And if we had a handout, I think that would be very, very helpful.
yeah, so I put the link to this handout, but can work on getting something more in depth.
The link that you sent out, it doesn't give us access. It's like request access, so you
Oh,
might have to just change the access on it. So when I
okay,
clicked the link, it said I had to request for access. So just update that, and then we can make sure at least the
okay,
link gets out.
okay, we'll
Or
do.
this handout, we can download it into a PDF from the link and get it out. So
Okay,
awesome. Cheryl has a question. Cheryl.
Sure. So, to the guidance that you shared about alcohol cannot be treated at a licensed treatment facility, does that apply to just public facilities or public and private?
public and private, anyone licensed by the state of Georgia, which everyone to provide the treatment has to have the license. So I will tell you that it has forced some actors to um, rightfully, I don't want to judge how people do it, but did you ever, things such as in your lifetime, did you ever smoke a joint? And if they say yes, they'll be like, oh, you got cannabis use disorder, so now we can treat you because you have cannabis use disorder and alcohol use disorder. But it's encouraging people to make up things, which I don't think is a healthy practice. But yeah, good question. Um, Everywhere it's prohibited.
Thank you, Kelly. This was very, Kelly and Michael. Thank you. It was very in depth and gave us some great points. I look forward to learning more about sort of how, again, I think to Esther's point, are there champions that we need to, specific people we need to be reaching out to, what language we need to use. And if you know, Voices for Prevention, we're an advocacy education organization. And so we have to be careful about how we structure our language. But some of you all out here may or may not have those restrictions. And so if you don't, you can do a little bit more uh, assertive ask. I'll call it of your legislators, but we definitely want to be educated. And so, Kelly, us being in prevention and not in treatment, this is helpful. And I think this is just an example as well where prevention and treatment can support one another towards a cause that will ultimately lead to shared vision for the state of Georgia around substance use prevention. So thank you for that. I want to bring up John Bringale. He is going to share with us. He's the project director for the Georgia Prescription Drug Abuse Prevention Initiative. So John, take it away. Tell us a little bit more about what you want to share and what legislation that we need to be aware of as we go forward into this legislative session.
All right. Can y'all hear me now? All right. Yay. Success. All right. Well, I was looking at the aisles of the different people, and of course, there's some faces that are very familiar, but then there's some that I do not know at all. So my first initial thought was if I majority of the group knew me, I was not going to do too much of an introduction. But for the purpose of those that don't know me, I don't want to skip this because I have a tendency to do that. So here's a little bit of a formal introduction, if you will. So my name is John Bringale. I serve as the Prevention Intervention Program Manager at the Council on Alcohol and Drugs, which is a 501(c) here, charitable organization founded in 1969. At the council, we envision a Georgia where lives are positively changed and futures are saved through prevention first solutions at home, in schools, and in workplaces. Our programs serve children, teens, parents, educators, employers, healthcare professionals, and policymakers. We're we have a special focus on at-risk populations, especially youth, pregnant women, seniors, individuals in recovery, and veterans. I have proudly served the council since 2010 as a Prevention Intervention Program Manager, where I also serve as the Project Director for the Georgia Prescription Drug Abuse Prevention Initiative. In this role, I facilitate the work of the statewide Georgia Prescription Drug Abuse Prevention Initiative Collaborative, which all of you are invited to join or be a part of, which the next meeting will happen on December 11th in Norcross. So, which that collaborative includes more than about 300 partners across the state. The Georgia Prescription Drug Abuse Prevention Initiative is funded and supported by the Georgia Department of Behavioral Health and Developmental Disabilities Office of Behavioral Health, Prevention and Federal Grants. This work represents more than just employment for me. It's my professional calling. To make a lasting impact, prevention must be fueled by empathy, focused on proactive solutions, and be driven by passion, most importantly. I'm an unapologetic ambassador for universal substance misuse prevention. So today, I come to you to talk to you about two things. Two urgent priorities. Now, neither one of these have legislation at this point. So I just testified in front of the Addictive Diseases Subcommittee for the Innovation and Reform Committee in Columbus about a month ago. And so I shared these thoughts with them. So I'll share them with you because they're apropos as well here. First, I'd like to address the critical need to expand our statewide drug disposal network of public drug collection receptacles. This expansion will significantly increase the safe and secure disposal of both prescription and over-the-counter medications, directly reducing access and availability, especially among vulnerable populations such as youth, those in recovery. Reducing access is the number one proven prevention strategy and a powerful line of defense in our ongoing efforts to prevent misuse, addiction, and overdose. Again, it's all about access. Secondly, I'd like to passionately advocate for the development and implementation of a statewide emotional literacy school campaign. I'm going to say that again. I would like to passionately advocate, and I'd like to invite any of you that have the same heart to passionately advocate for the development and implementation of a statewide emotional literacy school campaign, one that establishes emotional literacy standards across our elementary, middle, and high schools. These standards would aim to develop 6 foundational skills in our students while they're in school: self-awareness, self-regulation, empathy, social skills, motivation, and decision-making. I believe wholeheartedly and without any reservation that the integration of emotional literacy into Georgia's educational framework will not only build a stronger, more resilient, successful student, but also foster a Georgia marked by emotional control, empathy, compassion, and connectedness. As my colleague Jeff Breedlove often says, the opposite of addiction is connection. And the ultimate byproduct of emotional literacy is a connection with self and others through a set of 6 characteristics that virtually every human being has the capacity to develop and nurture regardless of education level. Consequently, prevention and recovery share a common bond in that to be successful in both, it requires a connection to self and others, which is only attainable through becoming and being emotionally literate. We can have a Georgia where emotional literacy is the norm, not the exception. These are not just two policy proposals. They're essential life-saving strategies to increase access through environmental strategy of the drug disposal network and build emotional literacy and resiliency in our high school graduates through the development of a universal emotional literacy school campaign. Both strategies are backed by research and rooted in best practice. So now I'll just cover, I'll give you a couple of documents that you can use to advocate on behalf of these two potential policy ideas. And if I'm not using the proper word, Carmen, let's see, who else is that? Michael, any of the rest that I know I've worked with. I do not want in any way put anybody in harm's way of doing anything more than advocacy. I'm not suggesting to do lobbying in any way. So if I say something that sounds like lobbying, that's not what I'm asking you to do. I'm asking you to join me in a passionate movement, in a focus movement around these two items. So the first one, and I have to give credit's due to Michael Mumper. I started working with him directly, and he and I have created these, what I call Carmen. I sent these to Carmen. The first one is called the Georgia Prescription Drug Abuse Prevention Initiative Fact Sheet. And on this fact sheet, Michael and I laid out the different pieces that are important to this conversation. The amount of overdoses, the statistics around overdoses, the 5 counties with the highest opiate overdose deaths are Madison, Crisp, Worth, Richmond, and Pickens. Now, in my initiative, too, by the way, just as a side note, I know I say it quickly, but I'm a statewide initiative. So I don't just cover any one county. So I'm blessed to be able to cover the entire state and also cover the entire lifespan and the care continuum, from primary prevention to intervention to treatment to recovery. So I'm not just a one-stop shop. Well, I am a one-stop shop, but I'm not just a one focused program initiative. So yeah, so Carmen, can you share this with them? This is the one that
I'm
says,
dropping the links. I'm dropping the files into the chat now, and then we'll also send it out.
so based on the 220, this is the one I'm looking at now, is based on the 2024 Georgia Opioid Use Disorder Statewide Assessment, which was by DBHDD. That's where the data comes from this. And then on the back of it, as important as data is important as data. So any of you that are on here that are data lovers, I love you too. And I think that is great. However, data doesn't change people, right? Passionate people, working and loving people, move people and change people. So on the back of this, Michael and I decided we need to put down there some stuff, not just the prevailing issues, but also how to deal with them. So you'll see that on this side too. Once you see it, I know you can't see it while I'm holding it up, it's blurry. But that's the first one that I'd like to share with you. The second one I'd like to share with you is called it's titled Opioid Response Strategies. And I think that speaks for itself. And it's literally that. It is a document, it's a handout, one-page handout that you could give to legislators. And that was the design for both of these. Michael and I designed these for anybody and everybody to be able to hand these out to anybody, to include legislators, to inform them. You can send it to them in an email. No problem. And so that second one was the opioid response strategies. Now, I do cover other prescription drugs besides opiates. I do benzos. I talk about all of the different prescription drugs that can be problematic. As great as the prescription drugs are, we all know how problematic they can be in the wrong scenario, in the wrong place, the wrong time with the wrong person. So I am not in any way, I've ever said for 14 years that the prescription drugs are bad. Prescription drugs aren't bad. It's the way we use them, right? It's not the tool, it's the application. So we make that clear too, right? So there's a lot of people that need different prescription drugs. And you probably know people in your life that need them. We just want to make sure they're being used and accessed properly and being used properly. The last one I have to share with you is my most latest. About a month ago, I created this, and this is called the prescription drug misuse and medication safety call to action for all. So you see that? This is a beautiful piece. Again, anybody, even if you don't have much experience in dealing with prescription drugs, you can hand this to somebody and it will speak to them as it needs to. Quick, takes you whatever, 5 seconds. Hey, if you're interested in the issue of prescription drugs, opioids in particular, here, you look at this. And and again, you can email it to them. So
Sure,
that brings
Esther
me to
came
talk.
up.
What's
Hey,
that?
John, Esther came off mute. I think she has a question.
Esther.
Yeah, I have a quick question. I think it's great. All the documents, I couldn't really see them a lot because of the blur, but I know that they're going to be
They're in the
fantastic.
chat. The links are in the chat too.
The chats, okay. Um, I'm thinking about, I know that a lot of our members um do stuff in by by counties, right? They have a coalition or they have a program or anything like that. These handouts, are they written in a way that we can use at our local community level? Because we have in our coalitions, we have people that are, teachers and all that kind of stuff, but we also have parents and we have other people. And so are these written in a level that we can use locally as well?
So yes, I think Michael, you want to chime in here too, because obviously I know I provided all the content. It was my responsibility to do that. And then of course, Michael did the amazing job of making it look pretty. See how pretty all that is. That's right. So Michael, and of course I know he added some content too, but Michael, so my answer to Esther's question about using it on the community level, so meaning that it could be understood. Is that what I'm hearing you say, Esther?
Yeah,
Uh-oh, what happened?
I'm just
Okay,
sharing.
so is
I'm
that what
just
I'm hearing you
sharing
say,
so
Esther?
that I'm just sharing so that people can see a little bit better.
Thank you.
I'll scroll
Yeah,
through each
that's
one.
helpful.
Yeah.
So, I've been training for 27 years of my work in this 37 years of I've been also simultaneously training, and we always want to make it understandable to maybe somebody that doesn't have a college degree, if you will, or just say, can John Bringell understand it? Because I say that because I'm very honest. I am nothing. I'm no brilliant scholar. So I'm just a hard worker. So can John Bringell understand it? Yeah, I can understand that. Fatal overdoses in 2022. Nearly 2,000 Georgians died from opiate overdose. More than that, twice as many as 5 years earlier. Right? My most important thing is what can you do? So if I'm looking at that, what can somebody do? Look at this. Put this one up if you don't mind.
Which one is that one? Which one is that
Carmen,
one?
this
Which
one
one is
here.
that one?
Oh, this is the prescription
Economic-
drug misuse and medication safety. A call to action for all.
That's not the way the file is titled, but let me see.
Oh, I'm sorry. It
It's
may not have been
okay.
titled that way in the document, but it looks like this. Got the two ladies on it.
It's the third one, fact sheet medication, Carmen.
Thank you. Okay. Let me stop
Go to
sharing
the
share.
back. Go to the back. The
I'm
back of it
headed.
is where I want to focus.
Okay.
And
The
I can
second
add
sheet.
John, can I add something to that?
Absolutely.
Okay. We did write these specifically in like layman's language. We tried anyway. But I will admit, people are kind of nervous about taking these to legislators. And I understand that. I still get nervous, but I used to be really nervous and I wouldn't do it until I finally did. And what I'd say is one of the things that helped me is that I had mentors, guides that would join me on these calls. So what I'd say is for people who want to take these to their legislator, invite John or me or someone to go with you and we can
Mhm.
back you up. I mean, I'll be happy to do it. I can lobby. I'm a lobbyist at the state capitol and
Well, I can't lobby, but I can advocate. I can educate.
well, the good news. Well, when I say I'm a lobbyist, this is about information. John's documents do not advocate for specific legislation, so they are not lobbying. They're education documents. The only reason I brought up that I'm a lobbyist is because I got a little more comfortability talking to legislators, and I know some of them, so we can set it up so that it's a not intimidating conversation. But look for a mentor or guide to go with you. And then I'd say, John, also another thing that might be helpful, these documents deserve a webinar where each box on the thing is walked through so people feel like they really understand it. And that's just an idea
Yeah,
anyway.
I like it. And V4P can sponsor it and we can put it together.
Yep.
Definitely. And I appreciate the fact that they're written in a way. And now that I'm actually looking at them, it's easy to read. Again, Michael did an excellent job with making it pretty. The bullet points. So I would feel comfortable taking this to my community and handing it out to all of my members and to parents and things like that so that they can become educated enough to understand why this is important. And I guess that's where my mind is coming from, because you can set this in front of me, but unless I connect it to why is this important, I don't see people at a local community level taking action. So that's kind of where I was coming from. And I think these tools will do that.
Awesome. Thank you. Are there any questions for our panel? We have a few minutes left.
Hey, well,
Uh,
can I
oh,
hit
you had
something else though, Carmen, real quick?
Sure. Okay. Yeah.
Okay. So, okay, that was really more about the initiative and about the drop boxes and safe storage and some other items go along with advocating on good stuff to support prescription drug abuse prevention, and prevention as it relates to all the substances that we might deal with, right? So, but can I take 2 minutes, if you will?
Yep. I'm
Two
gonna
minutes?
start the clock. I'm gonna
One
start
minute?
no,
2 minutes? Yeah,
2 minutes is
start
good.
the clock.
Yeah.
Start the clock.
Go
Okay.
ahead, John.
Okay. So the second piece that I spoke about, in my introduction, if you will, was this emotional literacy idea. This idea of emotional literacy throughout the state, the standards. How many of you have had a similar idea, or I saw some of you shaking your head when I was talking. I was watching you, and I saw you shaking your head. Now that was, I don't know if it was like in the affirmative or if you were shaking your head like okay. So how many of you, when I was talking about the emotional literacy across our school system and standards, it's like, hey, I agree with that. Carmen. Okay. Anybody else? Okay. Steve, Kelly, not to call you out, Kelly, but I saw you shaking your head. I don't know in relation to exactly what part you were shaking your head about. Maybe somebody was asking you a question in the house and you were shaking their head like, leave me alone. But this whole idea of emotional literacy, would the group, I hope the group would agree that, do we educate our kids on science, math, English, and all that, those literacy standards, right? So are they getting what they need as far as emotional support? Now, I'm not saying counseling. We're not doing counseling, right? We're not suggesting that everybody go around and be a counselor. That's not it at all. And if you don't have an understanding of what emotional literacy, how it's built through what's the practice of what's called emotional intelligence. And that's a huge, massive industry in the world right now, but it's in the for-profit business. That's where it mainly has its tendrils. However, over the last about year or so, I've seen us in this the social welfare space, public health space. It is now starting to creep into our space. A matter of fact, Kelly, there are treatment centers now in the nation that actually their whole business model is built on building emotional intelligence in their clients. One's in Colorado, so I could put you in touch with them if y'all. I've talked to Jeff about it briefly, but anyway, I've got a whole document here, and I'm just going to say the last thing, and that is this: Georgia can strengthen your youth resiliency by ensuring every county has funded primary prevention programming, by embedding emotional literacy standards throughout K through 12. This is not just about reducing risk. It's about developing confident, capable, emotionally mature young adults who succeed in school, at home, and in their communities. Closing. Investing in emotional literacy today is the most effective way to prevent addiction, improve mental health, and secure Georgia's future. Our children deserve the tools to thrive and the need for them to grow. So I've got all kinds of research. If any of you are interested in it, because you're definitely research people, I've got tons of research that I've been able to come up, through the last 5 years or so. I can put in front of you. So, and Carmen, well, Esther, I can make that available also, maybe in a different seminar, or a webinar or
Yeah.
whatever. So, to say that I'm passionate about it, that's not the point. The point is this: it's not about passion; it's about what's right. Our kids are not getting what they need in school. Yeah, academically, they're getting it. They're getting emotional, academic literacy, but they're not getting emotional literacy. And we're seeing the product of that. There's no doubt. You can't deny it. So thank you.
John, I have a question about that. Is there any type of legislation that has maybe not passed in previous years, or something that maybe isn't specifically about this, but that we could begin to look into and contact, or something about?
Yeah, I've got some people working on that. I've got a researcher working on that to see where we can kind of get our tendrils in. I will say this: I was invited by the Georgia Mental Health Policy Partnership to write a position paper for the Georgia Mental Health Advocacy Guide that will be going to all the legislators. So this is going to be in their advocacy guide when they start the session. When I'm holding in my hand, I can send this to you, Esther, and y'all can send it out for everybody, so y'all can see what the legislators are going to be seeing. It's going to have color to it. It's going to be pretty. But what I have in my hand is what they're going to get to start, kind of planting the seed, if you will.
Okay. All right.
So there's some really cool stuff going on. If
It
anybody's
is. I
interested in
know,
joining,
and I know you're passionate about it.
yeah,
I've heard you speak on this a lot throughout the years, and
yes.
again, my mind is coming from a point: what can we do to help people prepare for the upcoming session? And that's why I asked specifically, not necessarily is there a bill out there right now, but is there anything tied to this that we can begin to prepare? But we will be providing all of these handouts. We will be making things available besides these handouts, how to create an elevator speech, wow, how to make an appointment. Sometimes people have an issue with that. So we, as a project, we will be providing those kind of things, as well as an advocacy webinar later on, before the session, or right after the session begins. Carmen?
Yes, I just want to thank you all for joining. I hope you got all that you needed, at least from this, and know that we'll be sending out the replay, an email with the replay link to all of our network, as well as the handouts that were provided by everyone. And it sounds like that there's an opportunity for us to do more, even in some of this work, and highlight some specific things on separate, to give more time for questions and interaction around some more specific agenda items. So thank you all so much. And with that, we are going to close for today, and stay connected, stay in your communities. You are needed. What you do is important. If nobody told you today, you are amazing. Thank you.
Thank you, everybody.